A statement that I've heard patients say over and over again is, I didn't think that anyone cared.
The most rewarding part about being a community health worker is when but watching our patients grow, watching them develop confidence in themselves and develop their ability to communicate their needs and also advocate for themselves.
It's causing people to be more aware of what resources they have for them. It's causing them to not go to the emergency room as much and not misuse the emergency room.
I think what the community healthcare workers bring to the table is such an opportunity for us to influence people's healthcare decisions in the place where they live, in their community.
The cost savings of using community health workers is pretty impressive. And what we'd like to do is have employers, have hospitals, have those that want to have a productive workforce and keep people healthy, use community health workers in order to help achieve that.
At the end of the day, I think the thing that makes a community health worker unique is not necessarily their education, obviously, but it's an innate ability to connect with other individuals. It's an ability to build rapport, and it's some sense of shared experience with the community that they're working with.
It's caring in a way that you really easily gain trust with people. Healthcare is complicated and it's confusing, and it doesn't really matter where you live. Those barriers exist across everybody, whether you live in poverty or you have money, because it's confusing, it's complicated, and it's scary.
So the Kansas City Care Clinic got our start 1971 in the Kansas City community. Our core mission is to provide health care for the uninsured and underinsured. About 85% of our patients are actually uninsured today.
For a new patient that I would meet in a clinic, I would explain that I am a community health worker, and what my role would be, should they choose to participate in the program, would be to, number one, advocate for them to receive the services they're unable to find or in need of, to attempt to educate them to the best of their knowledge on self-care, provide them with as many resources as they may need: health, social services, housing, anything. I would be someone who would be there on their side and able to translate almost between them and the healthcare system. Also, there'll be a place here for you to possibly list the food you ate.
I am at a hospital that has a lot of under-resourced and underinsured patients. And so one of the things that we do with Kansas City Care Clinic is that when a self-pay patient comes into the emergency room, they are contacted, and then they come and they will see our patients and they will help them get established with a primary care physician.
We ask them a few questions. We assess what their health literacy is and whether or not they have health insurance or can afford health insurance. We also ask them about their ability to make it to their appointments, if they're having transportation issues, or if they have a lack of contact with other care providers. So we try to assess what their needs are and then offer our assistance.
Even if you go to different doctors, take it with you.
Some of those patients have needs that are outside the scope of what they can do at a primary care physician. They need somebody to follow up regarding their medications. Maybe they have low health literacy level. And so a lot of times what I'll do is I'll put a program together where I'll go and visit the patient in their home. I'll see them first in the hospital, I'll visit them in the home, and I've been going with one of the Kansas City Care healthcare workers to be able to work with us together and actually see the patient together, which works out really well. I go over the medication list with the patient to make sure they understand what medicines they're on, to see how they're healing, to see if they have any questions. And then the caseworker from Kansas City Care Clinic comes with us And they're the ones who actually sit with the patient as well, make sure that they are going to go to their appointment and sometimes even go to their first appointment with them.
We do these home visits just to check up on them and to see if they're okay, if they're, especially medically, and also to see what their surroundings are, to see if that's hindering their ability to care for themselves, to go to these appointments, just to see what the underlying problem is.
A lot of time the people that are working with the patients are people that are professionals and they don't understand their backgrounds and they don't understand the lifestyle that they've lived. And where the community health workers really differ is they've walked that same life of the patients. You know, I like to think of it as they're speaking the same language. So, you know, sometimes someone speaks Spanish and they speak English and you're not speaking the same language, and so you're not really understanding each other. They speak the same language. So they understand what, you know, what it's like to struggle and live in poverty, what it's like to have to use the emergency room because you don't have any health care. And so they really get those pieces in a way that somebody else doesn't, and the patient relates to that, and so it's just a natural trust builder.
A lot of times it is just a reminder to the patient that if you show up and care about yourself, then they'll show up. It's a team effort, and you can't always expect more from someone else than you're willing to invest in yourself. And sometimes just hearing that from a level voice, someone you can relate to, someone who has shown you they'll be there and that they care and that they'll take the time to listen is all you need. And it goes a really long way.
I'm a patient at the KC Care Clinic. Yes, I am. I have been for about 2 years. I no longer have to seek care at, well, say, your emergency rooms or anything. And also they provide a community health worker who, you know, has helped me tremendously.
When we first started working with him, he was homeless, array of chronic conditions, and he really hadn't found anyone that he trusted to work with. A lot of times he'd go into the hospital and he'd be pretty belligerent in that setting, and so instead of people wanting to engage with him, the opposite would happen, that they would be like, oh my gosh, this guy's so hard to work with. Well, we started working with him, and a lot of it became that it was a trust issue. You know, he would act that way because he was afraid or he didn't really trust people in the medical setting.
I was astray, lost, but, you know, they found me. It was a beautiful thing because I really didn't know about it and who they were.
Since we started working with him, he's been approved for Medicaid. He's housed, so he's stable. He had never, his doctor was the emergency room, so in a 6-month period, he had gone like 30 times to the emergency room. Well, it's been a year and he hasn't gone one time to the emergency room because he goes to a doctor. But really, our piece in that is he has a lot of questions, and you know, he has a person that he can trust. So every time he leaves the doctor, if he doesn't understand something, he can call us and we can reinforce all those things the doctor said, and we can communicate with the doctor and the nurse, and we can make sure they really understand his behaviors so he feels comfortable. So he's come a long way. You know, from a cost savings perspective of a hospital system, that's a huge success. But just in, you know, as far as him becoming healthy, that's an even bigger success.
I consider him an asset, a high asset, and a credit to the community. I think every community ought to have one of these places. I really do. It was a very good thing. It was a very good thing because it was all these doors open. She helped me with my paperwork. Her associates helped me with the paperwork. Things I didn't understand. Gave me that little push. You know, when you've got people helping you, I believe a person's more apt to help themselves.
One of the things that I think we've been accustomed to as healthcare professionals is saying, come to us. We'll take care of you, but you come to us. This is an opportunity for us to say, we're going to reach out to you. You may initially see us in the emergency room department. You may initially see us as an inpatient at the hospital, but we're going to work with you to take your health care now from the hospital to the home, from the home to the patient-centered home medical model, and back again. And one of the things that I've loved about this program is that they are our hands, our ears, our eyes. And so what I can't be there to do all the time as a healthcare professional, they're seeing things, they're calling me, we're in constant communication.
We help advocate for them. We help with the resources. We can explain things to them.
We're here to empower people to take control of their lives, and health is one of the biggest pieces, or the biggest areas that can happen.
I prefer to value each person and offer the service that I know I can provide, which is the literacy, the compassion, the diligence.
It's just really amazing to see people succeed in the system because it is so complicated, and I think a lot of times the people who are implementing the healthcare, you're embedded in it, and so you don't see all those little baby steps that makes it hard for people to really make the changes that they need to in their life.
So you may ask if a community healthcare worker is adding another layer to the healthcare cost. And I guess my response would be no. There is a cost that we have in the healthcare system if we do not take care of our patients the way they need to be taken care of. Some of what we have seen in the system is behavioral changes that are needed in the general public. I can't go and tell you what to do, or I can, and I have done that at my health literacy level. You may, number one, not understand it. You may, number two, not agree with it. And you surely, number three, aren't going to do it just because I told you to do it. But if I get a healthcare worker with me who comes alongside of me, we work together, we actually go into that home, the trust level of that patient increases.
We measure a pretty robust number of different types of outcomes that we're looking at. On the cost side, we're looking at some of the big ones that everybody else is looking at. Are we keeping people out of the ER at a rate that is different than if we hadn't worked with them? So, you know, if we work with people that initiate from an emergency room, we look at, over time, does working with a community health worker in any capacity decrease the likelihood that you're going to come back to the ER? And our program consistently over the entirety of our existence has shown that that is true. So working with our community health workers, you're much less likely over a 3-month period, over a 6-month period to come back to the ER. Similarly, looking at, you know, are you less likely to rebound and have to be admitted again? So looking at some of those large-scale costs, you know, and with one hospital system that we work with, that cost just within a single year, and looking at it very conservatively, is about $1 million. With only 2 community health workers working with that hospital. So, you know, the return on investment there is pretty high.